Hello and welcome to the Florida State Oriental Medical Association FSOMA News for August 26, 2021. We have David Bibbey, our president, and Rafael Perez, our treasurer here, and they're going to be talking about a few things. Your FSOMA office is me. I'm the executive director, Ellen Teeter, and director of communications is Natalia Morrison. Your president is David Bibbey. He'll be speaking in a minute. And your board of directors is right here. And we have a number of committees. So we'll familiarize you with some of that right now. First, we're going to just review member benefits. We have several law firms. The Florida Healthcare Law Firm, which is a healthcare specialty law firm, offers us reduced rates and 15 minutes of free consultation to FSOMA members. We also have Tracy Law, and he's more of just a general business lawyer who offers the same deal. You get a free CE broker account. We're members of the American Society of Acupuncturists. We have a job board that you can see in the e-news and find on the website. Insurance billing and business help desk, and many more. Reductions on insurance, Office Depot, big savings on Office Depot, and free access to several journals. So I'm going to let Rafael now talk about board development and nominating.
Good evening, everyone. I'm really happy to be here tonight. We have our annual elections are coming up. Right now at this moment, we are taking ballots. For anyone who wants to run on the board, we're looking for 7 positions. We have 7 positions to fill. It's an amazing opportunity for anyone in the profession to really get involved and have a say. It's our association. It's a great way to really get connected, learn about some of the challenges that we're facing, some of the opportunities on a state level, on a legal level. It's a great way to learn more about what other acupuncturists are doing, the successes that they're having. It's also an incredible opportunity to learn how to work in a group. So I want anyone who's on the call who's listening to this later to really consider the small impact that you can have. A small amount of time and actually have a great impact. It's really easy to get started. It's not an incredible amount of time dedication. It's a great way to get started. So I encourage you. We are taking nominations. You can self-nominate and you can nominate someone else. We're doing that over the next few days till the end of the month. And then we are going to reach out to everyone who's been nominated and get them to accept the nomination. And then from that, it's a straight road to the voting, which will start at the beginning of October and go right away to October 31st. This is a really good opportunity. If you have any questions about the time commitment, about the job, about the focus of how to operate on it, please reach out to me. It's Rafael at FSOMA.org. Rafael, R-A-F-A-E-L at FSOMA.org. And thank you.
Now, I did just see a little error. This is an older slide that hadn't been updated. The president is David Bibbey, but you can talk to David or Sandra. She's still on the FSOMA board, and Rafael about a committee or serving on the board. It's a great way to support your profession and get some development for yourself. I want to talk about the Wellness Committee. The chair is Demita Hartz. We've got a website, FSOMA.org/wellbeing, that has a lot of stress, addiction, and mental health resources, both for you and for your patients. We've had 2 workshops. One's happened and one is coming. Recognize addiction symptoms in yourself and others. That's available on the YouTube channel now. And then coming up in September 21st, we have Wellness in the Workplace, 5 Strategies for Protecting Yourself. That'll be a great webinar. Coming up September 13th rather, is Building Better Business, How to Find the Right Hire and Build the Right Team to Grow Faster. And we've got 3 CEU classes coming up. A SUGI self-care microsystem for clinic and telehealth use coming up September 25th and 26th. Frank Urasek and Satara Vishnu have been practitioners for probably 40 years. They have used this system and developed it to a very high level, both with veterans and in the Strozier Hospital in Chicago, and they have a lot of knowledge to share. Effective treatments for common facial conditions with Michelle Gellis. She's an expert in cosmetic acupuncture, and that's coming October 16th. And then ethical and practical acupuncture billing and coding is being co-sponsored by American Acupuncture Council. That's with Sam Collins, October 24th. That will be a live event. The other 2 are virtual, although SUGI will be both live and virtual. FSOMACon 2022, we're going to be back at the Wyndham Grand Hotel at Bonnet Creek. So save the date, August 19th through the 21st. And then here's some news I thought David could share, and then he's going to go into some other information. Oh, you're muted.
Thank you, Ellen. Thank you, Rafael. I appreciate the good news this evening. I'm going to start with news out of Maryland. The Maryland Acupuncture Society looks like they've introduced and had a bill brought into law for AIT. It was signed by the Secretary of Health and it's pending signature from Governor Larry Hogan. This is, good news in terms of creating, expanding the standard of care for acupuncture to include acupuncture injection therapies by, increasing that state by state. It strengthens the profession. I just want to, it says the Maryland board members, Denise Tyson and Lynn Vance, are continuing to meet with Cigna regarding the ASH partnership in coordination with their lobbyist, Haley Evans. And I guess the subject of discussion is probably the practices for reimbursement and the standard of care as it applies to how acupuncture is used in a treatment setting, whether it's one unit of acupuncture or more than one unit, and whether certain manual therapies would also be included under that benefit. So I'm glad the discussion with ASH is continuing. Ellen and I met with ASH representatives about 6 months here in Florida, 6 months ago, and they said that they were making some unique concessions for reimbursement here in Florida, but that's evolving. It's probably something that ASH is going to work on state by state with providers. The ASA virtual conference is September 10th through 12th. That's a live online participation is requested, and FSOMA members are welcome to join at a discounted rate. Acupuncture making the news on various media publications. Shape Magazine, the American Journal of Managed Care, Harvard Gazette, and celebrity singer Lizzo have made headlines on multiple publications, including Instagram, for receiving cupping and acupuncture. So we're seeing, more and more visibility with celebrities engaging in using acupuncture. That's always good for the profession, as well as more research-based information shared through journals. There's a new clinical trial. It looks like here it's a multi-center, double-blind, placebo-controlled, random controlled study of modified Chife Pao Dutong, I guess for COVID-19. This is going to be a WIND formula. And we'll be looking for, published feedback to see how the study goes. So Jennifer Broadwell has been our advocacy chair for some time now, and I know she made a sort of a full-throated presentation on this at the conference not that long ago, but I just want to revisit the 2021 strategy for the advocacy committee. It started in the first quarter with a letter writing campaign where we worked with members and anybody else interested in contacting their local state legislature with template and model language for a letter writing campaign just to introduce yourself. This really the first step toward developing a relationship with your local county, your local elected official. And it's a strategy that's well understood for creating relationships where later in the session or later in the year, if we need to make a visit in person, it certainly makes it easier to interact with staff and elected people if they have some history of communication with you. In the second quarter, Acupuncture Education Day was a virtual event this year. There was a lot of enthusiasm and effort put into having participation from acupuncturists and students around the state to interact with, again, their local state and representatives and state senators. In the third quarter, this is the time when district meetings take place, typically with the legislators after the session in their district offices. We, for the Advocacy Committee, had a very detailed point-by-point instruction for calling, making an appointment, setting an appointment, how to follow up in person with your local legislators. And again, this is about reinforcing this relationship that we're trying to create with elected officials so that when subjects of interest come up that are important to acupuncture, we have an ongoing discussion and relationship with people who are in a position to help the profession. And rather than starting at a cold stop and trying to catch their attention, it's very difficult to do with all of the many distractions they have. The last part in the fourth quarter is to develop talking points for the 2022 legislative asks. And usually each year we like to have a short list of requests for legislators that for issues, whether it's a bill or a policy that affects acupuncture practice in the state. Usually it's about providing greater opportunity for access to care. We've seen this discussions with coverage for insurers. The subject that we're looking at in 2022 is that Florida has finally taken Medicaid expansion money from the federal government, and there's some enthusiasm and support from legislators to codify acupuncture as a essential benefit under the state Medicaid plan. One of the things that helps bolster that argument for us is that the statewide managed care plans under Medicaid, there are about a dozen or so, all of them include an acupuncture benefit, but their basic Florida Medicaid plan does not yet. So that may be a policy change or it may be a change in law, but it's something that we're working with legislators for in 2022. And so you can see here as a 4-step plan, not to just jump in and say, hey, we want you to update and change Medicaid without having any prior relationship with the acupuncture community. We want to start by writing letters early in the year, doing a virtual education event for Acupuncture Education Day, meeting with people in their district offices, and then finally, working toward using that relationship productively to say, we have something that we think is important for the citizens of Florida. We think that providing more acupuncture benefits to more people is a good thing, reduces costs for healthcare, reduces dependence on opioids, it creates better outcomes. And so there's lots of data to support everything that we would otherwise assert, but it's hard to do that with no relationship. So anybody that's listening that's interested in these types of projects or learning a little bit more about it, Rafael's request at the beginning to get involved with the board can be simply joining a committee like the Advocacy Committee, or self-nominate yourself to join the board and become a little bit more engaged in helping develop plans and ideas about how we can move these things forward for the profession as a whole. Next slide.
And I'm just going to say, you don't have to join the board to go visit your legislator.
Oh, no, yeah, please. Yeah, you don't have to join a committee.
No.
This is completely something that we have a toolkit. It's available on the website for FSOMA. You can talk to myself, David at FSOMA, contact Ellen, and all of the tools that we're showing you here in terms of this advocacy strategy. They're straightforward, easy to understand, readily available, any and all assistance that you need to just, pick up the phone and call a local legislator and begin your journey toward a relationship with that person. It's relatively straightforward. We're happy to help.
Great. We can just let people read this for a minute.
Thanks, Ellen.
Yeah. This is the website, FSOMA.org/legislative-campaigns, gives you all the information you need. We've had live trainings. We've had some other things we've offered, and those videos are available. You can call the office. You can email David. We can help get you set up.
And so, do you want me to do the ASA?
Yeah, but let's go to Medicare.
Okay.
And I'm sorry, it's just taking a little slide to get.
That's okay.
Time to get past this slide. There we go.
Sounds good. Okay, so the news at the end of July, you can see here, we have a national acupuncture champion, and that's Congressional Representative Judy Chu from California, 27th District. She's, again, introduced a bill that would amend the Social Security Act to include acupuncturists as providers under the Social Security Act, which would make us eligible to treat Medicare beneficiaries directly and without supervision. There's a lot of moving parts to the bill, but basically all that's required is that we open the Social Security bill, insert the word licensed acupuncturist, and that would expand the eligibility of people that are that can get acupuncture benefits under their Medicare plan. Right now, if people are familiar with this, know that it's sort of divided in half between the people with Medicare Advantage, that's managed by companies like Humana, Aetna, Cigna, United. We often contract directly with those companies, so those Medicare beneficiaries are eligible for acupuncture. Anybody under original Medicare, it's complicated by a direct supervision requirement because acupuncturists are not named and listed in the Social Security Act. So here, House Bill 4803 is introduced again to provide coverage for acupuncture services under the Medicare program. Those services are provided directly by licensed acupuncturists. So the Office of Judy Chu is looking for co-signers for that bill, and we're waiting for instruction from Ellen Hamilton, her legislative aide, as to when and how the individual states and individual licensees can get involved in helping support bringing the bill forward in Congress. So we'll continue to update on this throughout the late summer and fall. I'm sorry. So it says, where are we in the process? Okay.
Pretty much we're just looking for sponsors, co-sponsors, Republican co-sponsors especially. We don't want this to be a Democrat or Republican bill.
Right.
So right now there's nothing for the in the trenches acupuncturists to do, but there will be shortly.
Exactly.
So, this is what you can do right now.
Yeah. Reading the bill and being familiar with, its purpose and how it affects licensed acupuncturists is something that's in your interest. Certainly, we'll probably have a synopsis as this process goes forward, but it's important also to understand the legislative process. Things often take a lot of cooperation and a lot of effort. And unfortunately, sometimes it takes more time than we want, but it's a complicated process to get everybody on the same page and to agree with anything in government. Here, it's a relatively small ask, and it's an issue that people are pretty familiar with. And I think if there's a positive here is that the legislation that's being introduced by Judy Chu is designed to fix an existing problem. The problem is CMS has approved acupuncture for chronic low back pain, and half of the people eligible under Medicare can't get access to their benefits. So, you know, it's helpful. It's always helpful if the purpose of your bill is to fix something that's either inherently unfair or broken in the process. And it's a little bit different than just, you know, pushing ahead with an idea that we think it's a good idea and everybody should have this. The bill solves a big and existing problem. So hopefully it's something we can get done this year.
Okay, that's the end.
Thanks, guys.
So let's just see if you have any questions, you can stick them in the chat or the Q&A. I don't see anything right now. I want to welcome everybody. We didn't do that before. We've got Elise Beccaria, Elaine Onifree, Lisa Forsyth, Michelle Perkins, Mike Kovach, and Sonia Yoon on board.
Thank you. Thank you for joining us.
Thank you. So please put in some questions if you have them. And if not, if you have them later, you can always contact the office, call us, email us. And if we don't know the answer, we'll find it for you. So we're here to support you, support the profession, and make acupuncture available to all the people in Florida. I'm telling you, if somebody's listening to the news on a Thursday night at 7:30, you should be self-nominating yourself for, you know, some participation with the board, you know, something that you're passionate about, something that you care about, and let us help you in any way, you know, make that happen. It's a lot of fun. It's a great way, like Rafael said, to kind of get engaged with the profession. It doesn't take a ton of time, doesn't take a ton of energy, but it can have a huge impact. So please, if you're joining us tonight, you've already got my vote. You know, I'd say, right, you know, consider joining. Okay. All right. Thanks so much. Thank you, Rafael and David, for taking your evening. And thanks, guys. We will see you later. Take good care. Thank you all. Bye-bye. Good night, Rob.